Senator Jim Abeler is the chair of the Senate Human Services Reform Committee, and I spoke with him about the workforce crisis. Compelling testimony was shared during your committee about the situation that nursing homes and long-term care facilities are finding themselves in. Do you agree that this is a potential powder keg with a short fuse?
Oh, thanks. And Shannon, as great as it is to see you again, I'm sorry we have to get together and talk about this. This is one of the biggest looming crises we've had in a long time. It is indeed the perfect storm where a very rickety long-term care system has been met by COVID and now met by a mandate from the federal government. And together, it could actually result in grandma being in a minivan outside a hospital waiting to be in where there's no bed to put her. And that is what's before us here. And the date that this is all gonna come to a head, if it does, is gonna be December 5th, when people have to have their first vaccination. And that is not the cause of all this, but it adds on to it. And it just provokes a very, very challenging time.
To that end, you spoke with Department of Human Services Commissioner Jody Harpstead this week. Did that conversation lead to any potential pathway through this?
Well, first I want to commend her for her engaging attitude toward us in the legislature and an effort to collaborate and find a way to do a partnership. I should just have to add in stark contrast to the governor, who cannot find his way to return my calls when I'm trying to offer him advice about how to get through this. Last year I gave 13 outreaches and finally got him to call back after 4 months. And the way to solve this is in the trenches in a collaborative process with people working together. And with all respect to him, one man against COVID is not actually succeeding in Minnesota. And so thanks to Commissioner Harpstead for reaching out to try to be a model about how this could well be done. And so part of the problem is money, part of the problem is workforce, and part of the problem is just the weakness of the whole industry. And so the commissioner and the governor are going to put $50 million to nursing homes to let them spend as they like to shore up their challenges. I admire that as a good start. But the focus is not as much on workforce as I think it needs to be. There are people leaving in droves. I just talked to one of the leaders 2 days ago. 2,000 people a month are leaving nursing homes as workers out of 48,000. That can't go on very long. And it's exacerbated by people's fear and their unwillingness to take a vaccine and not be allowed to exercise their religious freedom and even have people recognize their medical exemption status. And to me, that unreasonableness is making this even more difficult. But I want to thank the commissioner for engagement and for coming up with the beginning of a plan.
So you mentioned money. If wages were higher, and this has been an ongoing conversation with the legislature, if wages were higher, would that make a difference?
Well, sure it would. But there's a lot of competition for human beings. And so hospitals are in challenge, group homes, and now nursing homes. The challenge with nursing homes is that people in there, if they're not served, are going to die. People in group homes with a disability, if they aren't served there, they'll go live with their family or somewhere else and they'll be kind of okay. Hospitals can defer any elective surgery, so you have to have a bad knee for a little bit longer, and they'll keep their urgent care and their critical care going. This is an industry where if a place closes, where are you going to put these senior individuals and these people with very serious disabilities? And just even the trauma of moving from one place to another is a lot. And so this is going to be the flashpoint, and this is where the attention needs to go. And if I were the king, and you should know well enough that I'm not, I'm just one legislator from R-Anoka doing my best. You got to find a way to stem the tide of 2,000 people a month leaving and try to draw some more people back and try to find a way to build careers. And it takes a focused, collaborative effort, which we could come up with, I believe, if we all can work together.
Well, I hear you saying that the potential straw that breaks the camel's back is this vaccine mandate from the Biden administration that all healthcare workers by January 4th of next year have to have the full series of COVID-19 vaccination. Senator Paul Udke suggested that the state should push back against this federal mandate for healthcare workers. But what happens if some nursing homes don't comply? And also, more importantly, perhaps, how do you balance the workers' right to make this choice against the health and well-being of vulnerable and elderly people, who could become sick?
Well, and I think first you want to step back and tell it the success where we've had in addressing the infection rate in nursing homes. It has stabilized. In the beginning, it was pretty well ignored by the administration, and we spent more time worrying about hardware stores on Main Street and little gas stations, and not where all the cases were at. It was truly an epidemic in the nursing homes early on, and the effect was everywhere. And so the focus that finally got directed there by the administration has worked, and the cases coming out of nursing homes are very minimal now. And so they've got their PPE, they've got their sanitation, they've got their distancing. It's actually not the problem area anymore. And so, but you have to have bodies there, and there is no other treatment that is out there these days that somebody has to do against their will. If you have pneumonia, you don't have to take the penicillin. You would sit there with your doctor and you would sit there and consider, well, this is your situation, and they would do an informed consent time. And they would say, well, you're actually a low risk, and actually you're at a higher risk of some of the adverse reactions, so maybe you really shouldn't get this. And by the way, you already had COVID, you have a lot of antibodies. You don't even need the vaccine. But unfortunately, even the antibodies and the people that are already are pretty well immune to COVID are not even being considered. But even along the same lines, people's religious freedom and the ability to express their faith is tantamount to Minnesota and to our country. And for heaven's sakes, if you have a medical allergy to some of the ingredients, why should you be forced to take it? So if you would just do those things, and people go like, oh, I'm good, I'll stay here. And then when they're going to be forced out the door against their will, they actually like doing this. The people who are left behind, who are qualified workers, are going to be so overloaded, they're not going to be able to hold up with the load. And this is not anti-vaccine. This is pro-informed consent. This is pro-science. This is pro-modern medicine. How do we treat people who are at risk, and how do we treat them differently than those who are not? And that seems to have gotten lost in this.
I want to ask one more question about a workforce shortage, because we do have a demographic change underway. We are going to have, as a state, so many people who are older and fewer people who are younger. What is the role, in your view, of immigration in staffing nursing homes, long-term care facilities? Because historically, immigrants have done those jobs that are lower paying, or jobs that more established Americans don't want: mining, factory work. Could immigration be a potential solution to getting our staff in nursing home and long-term care facilities?
Well, it already has been. If you look at the cadre of the workers, a lot of them are new Americans, eager to work, eager to experience the American dream, eager to be self-sustaining and to serve. And they make amazing employees. And so absolutely. And we have to maintain the integrity of our borders and all of that. But how do you attract more people in? This is a great entry-level work. If we can make it a career, if we can help the wages to be that they can afford it, if they can get benefits, if they can appreciate the stability of our community that they become a part of, and these nursing homes are communities, then that's absolutely part of the solution. Staving the outflow, bringing people back, and getting stability again for grandma, so she doesn't wind up in a minivan outside a hospital just before Christmas. We have to have that not happen. And the answer is working together. Time for the administration to reach out, draw us all in, bipartisan, and find a way to solve this together. That's the answer in my mind, and I'm willing and excited to be a part of that.
Senator Jim Abeler, it is always so good to see you. Thank you.
Thanks. Happy Thanksgiving.